great honor and pleasure to chair this session with our very distinguished speakers. We will start with Dr. Ulrich Bauhofer, who is best-selling author, popular speaker, one of the leading experts in health, stress, and energy management. He's the president of the German Society of Ayurveda, which he informs me was the first society to be created. There's some question about that, though. Dr. Bauhofer really was the first physician to work closely with Maharishi on Ayurveda. He really is an incredible pioneer in this area. He worked very closely with Dr. Dwivedi and the other Ayurveda experts. He was in India with Maharishi, trying out really in a very pioneering way all the programs. So he's really very much the grandfather of doctors of Ayurveda, and it's an enormous pleasure for me to introduce him today. Thank you.
Thank you very much, Keith, for this very generous introduction. It just evokes many sweet memories, which I had when we really started Ayurveda here in the West. My topic today is time-tested, scientifically verified solutions for the health problems of our time. When we speak about solutions of problems, then we should first identify actually the problems. What are the problems? When I was in medical school, and I look back actually what I have learned a lot about disease, but after my studies, I was thinking if I have become really a health expert. And then it became clear to me that in 6.5 years, I never heard one single lecture about health. And I think this is true for all medical doctors in their training, that when they finish, they know a lot about disease, but they don't know anything about health. Now, as trivial as it may sound, but the biggest problem in health care is that people are not healthy. And our healthcare system doesn't make them healthy. According to a study in Germany, there are only 11% of the people in society who consider themselves healthy. That means 90% of the population considers himself not to be healthy. And with 90% of the population suffering from ill health, that means a huge financial burden on public health. There are mainly two reasons for the explosion of costs in healthcare, especially in the industrialized nations. And both factors are interconnected. The first cause are chronic disease. They are responsible for about 80% of costs in the public health services worldwide. The main diseases are cardiovascular illness, pulmonary disorders, metabolic diseases, mental illness, and infectious diseases. The cost for treatment of cardiovascular illness alone is worldwide about $1 trillion. 20 to 40% of the health expenditure worldwide is wasted through inefficient health care. Now, we have to look actually how chronic diseases are mainly erupting, and the reason for that is basically, as we have heard already by Dr. Renate, lifestyle. That means bad nutrition, lack of exercise, excessive stress. For example, the WHO has declared stress to be the major health challenge of the 21st century. Further, cigarettes and alcohol. Every 10 deaths worldwide is actually caused by tobacco. Therefore, lifestyle modification is the key factor for reducing costs in public health. The second reason for cost explosion is the demographic development in the Western world especially. Life expectancy in Europe has risen to 75 years with tendency to grow further. And ladies have a higher life expectancy than men. But with growing age, also chronic disorders are increasing, in particular in case of unhealthy lifestyle. But this simply means that with the elderly constantly growing in number and consequently costs amounting, our healthcare system will not be affordable anymore. Preventing the economic collapse of healthcare, we are forced to change strategy in healthcare. So far, our healthcare system has focused totally on the treatment of disease. And we have to change the strategy to the prevention and health promotion. For that, of course, it would be first necessary that doctors are trained and other health professionals are trained to actually make sure that people live a healthy life. Previously, it was the tradition that doctors were responsible for the health of the people, and when people were falling sick, doctors were considered to have failed. This has totally changed. Now, according to WHO, 80% of premature death could be prevented through healthy diet, regular exercise, abstinence of tobacco, and stress management through effective relaxation techniques. When we consider the requirements which a health strategy which is effective to solve all the problems of healthcare, then we will find that Ayurveda actually fulfills all these requirements. Now here I have made again a list actually what the major health problems today are. Chronic illness, growing life expectancy. It sounds a little bit absurd that growing life expectancy is actually a big health problem. Increasing costs, lack of effective prevention strategies, and side effects and iatrogenic diseases. Many diseases are actually caused by the treatment. Now, when we look that Ayurveda is the solution, then we should be aware that Ayurveda gives us, as the science of life, the knowledge about the laws, how actually life functions. When we look at traffic, then it is necessary that we follow the rules of traffic. Otherwise, we will have a high probability to have an accident. When we follow the rules of traffic, then this probability is actually diminished. The same is true for our health. When we act constantly against the laws which are responsible for life, which are responsible for our healthy functioning of the body, then the effect will be that we will fall sick. But how to know these laws? Of course, we cannot know all the laws which guide life intellectually. It is necessary to jump into this area, to connect our consciousness with this area where all the laws of nature are actually at home. And this is the field where Dr. Hagelin will tell us, where the unified field of all the laws of nature we can actually identify in our consciousness. Now, which are the requirements of an effective and successful healthcare system? The health professionals must be well versed with health and not only with disease. Our healthcare system must be holistic, but at the same time, it must be personalized. As we have heard from Maharaja, every one of us is different. And this holistic, personalized system of healthcare, Ayurveda is actually providing. It must be health promoting. it must have its focus on prevention. It must be prevention-oriented. It must be, of course, cost-effective and affordable, which a health-promoting and prevention-oriented healthcare system is actually making available. It must be realizable, it must be efficient, it must be proven, and it should not have side effects and adverse reactions. All these requirements are actually fulfilled by Ayurveda. And it will be a great joy during this conference to see, also from scientific studies and scientific research, that Ayurveda is in fact fulfilling all these requirements. Now, I also have made a substantial contribution that we are not too late and everyone gets, because this is a very important part of lifestyle, that everyone gets in time his food. But before I finish, I have the great joy, which Maharaja just said to me, that according to the inspiration of Trigunaji, we will have in 2 years, or from 2 years onwards, every year at this conference, the Maharishi Mahesh Yogi Dhanvantari Award, which will be given. Thank you very much.